Displaced intra-articular calcaneal fractures account for 75% of all the calcaneal fractures, and they have been associated with poor functional outcome. With the CT images, with the advent of CT images, it has helped in the operative planning because of the better understanding of the fracture anatomy. However, the literature has failed to demonstrate an indisputable superior result of any one type of intervention. Our aim was to compare the results of operative and non-operative treatment of DISEFs in terms of functional outcome and complications. It was a retrospective study conducted at a tertiary care center. A total of 51 patients with 58 calcaneal fractures were included. All the patients had undergone a CT scan for better understanding of the fracture anatomy and classification. The inclusion criteria were patients between 18 to 60 years of age, Sanders type 2 and above with a minimum follow-up of 12 months were included, while the rest were excluded. All the patients were at the follow-up were assessed using two scoring systems. One was the American Orthopaedic Foot and Ankle Score, and the second being the Functional Outcome Assessment Score by Thorson. 28 patients were operated while 30 patients were conserved. Age distribution was 20 to 46 in the operative group and non-operative was 29 to 56, indicating that patients above 46 years were not operated. And there was a clear male preponderance in both the groups, with Sanders type 2 predominating in the operative group and Sanders type 3 and 4 predominating in the conservative group. The AFR score indicated that there was no significant functional outcome difference between the operative and the non-operative group, as the mean AFR score was 75 and 77 in operative and non-operative respectively. And both of these results fell in the fair result category. And this was in accordance with the functional assessment score, which again showed that the mean score was 74 and 75 between the operative and non-operative respectively, again falling in the fair result category. We have two similar case illustrations. One was a 34-year-old male with a Sanders type 3 fracture with an increased angle of Gizien and decreased bolus angle. This patient was conserved. This X-ray shows a 2-year follow-up with maintained angles, and there is a mild arthritis of the posterior facet of the subtalar joint, but patient was pain-free and was happy. And this is the second case where a 26-year-old male with a Sanders type 3 fracture having a displacement of the posterior facet more than 2 mm with a lateral wall discontinuity. This patient was operated, and this is a 1.5-year follow-up where it shows a good lateral wall reduction. The posterior facet displacement has been corrected. The subtalar joint looks congruous. However, the patient was unhappy. He was having a chronic residual pain for which he had to wear a soft heel shoes for ambulation. The complications, as you can see, was significantly higher in the patients who were operated. 3 patients were having superficial infections and wound adhesions, 2 with hardware complications and 1 with deep infection. However, the non-operative treatment had only 1 complication in the form of subtalar joint arthritis. These are the few images showing the complications following operative management, where there is a superficial wound adhesions, skin necrosis and wound gaping has occurred, which healed by secondary intention. This is the X-ray showing the screw impinging on the soft tissue, and the image on the right shows a screw getting exposed due to wound adhesions, for which the screw had to be removed. And this is a 2-year follow-up of a patient who was conserved, showing a significant subtalar joint arthritis with lateral wall discontinuity. So to conclude, there was no significant difference between the functional outcome of the two groups in our study. However, the complications were significantly higher in the operated group. So the authors are of the view that conservative treatment is better over the operative treatment due to the low complications rate. Thank you.